Well, a lot of you have had trouble getting a COVID vaccine in Oregon this year, but that is set to change. Oregon Governor Tina Kotek announced today she's directing state agencies to make the shots available at pharmacies and doctors' offices without a prescription. That's after the new West Coast Health Alliance today issued a recommendation for the vaccine, along with the flu and RSV vaccines. The alliance was created between Oregon, Washington, California, and Hawaii earlier this month in response to recent turmoil at the FDA and the CDC. Now, the alliance is now recommending the COVID vaccine for all infants between the ages of 6 and 23 months, all children age 2 and up who have never been vaccinated for COVID before, and anyone with medical conditions that put them at greater risk from COVID infection and/or if you'll be near someone who does, and for anyone who wants the vaccine, regardless of whether they have any risk factors.
So we're not going to ask you your reason. We're going to not ask you if you're doing it because you're worried about getting COVID yourself and potentially missing school or missing work. We're not going to ask you if you're getting this vaccine because you live with your grandparent who has, chronic lung disease and uses oxygen. We're not going to ask this because you're taking action to protect your spouse who's being treated for a rheumatological condition and they're immunocompromised. We're not going to ask you if you're getting this vaccine because you just want to take action to protect the coworkers that you spend 8 hours of your day with in an office. If you are choosing protection, that's reason enough to be able to get it.
Now, that differs from the FDA recommendation, which says that only people with medical risk factors that make them more vulnerable to COVID should get the vaccine. The CDC has not yet issued their recommendation, so that's why it was difficult to get one in Oregon. But effective today, pharmacists are now able to give them out. Insurance, including Medicaid and Medicare, should be covering the shots. Officials say it may take a few days for providers to have the vaccines ready. And while we're on the topic of vaccines, let's head to Washington, D.C., where a Senate committee hearing this morning featured former leaders of the Centers for Disease Control and Prevention, or CDC, talking about how federal guidance on COVID vaccines was changed by Secretary Robert F. Kennedy Jr. Questioning came from Washington's Democratic Senator Patty Murray, starting with the CDC's move back in May to no longer recommend the COVID vaccine for most children and pregnant women, an announcement that RFK made in a video on social media.
Dr. Howery, I wanted to ask you, how did you learn about CDC's new COVID vaccination guidance in May?
The same as you on social media.
What was your title at CDC when that happened?
I was the chief medical officer of the agency.
It's unthinkable to me that the chief medical officer at CDC was left in the dark about such a consequential public health decision that affected real people. Dr. Howery, how was this change in guidance supported by scientific evidence?
We have not seen the data yet. In fact, after the tweet came out, we asked for a written memo from HHS because I couldn't implement guidance off of a tweet. The written memo didn't say the same as the video. There was a difference between healthy versus all.
You can't provide guidance off of a tweet.
I didn't think that was prudent. And then we did ask for the data to back it up, and we have not received the data to date.
To date, no evidence. Okay.
As we reported earlier this month, the CDC's revamped Advisory Committee on Immunization Practices, or ACIP, will meet starting tomorrow to consider federal vaccine recommendations. Many states, like Oregon, previously relied on that committee's recommendations before the West Coast Health Alliance, but ACIP was gutted by RFK, who fired all 17 people on the committee and replaced them with his own choices, described by some, including Senator Murray, as vaccine skeptics.
Will either of you feel confident telling parents they can now trust the ACIP recommendations that come out of this week's meeting?
I'm very nervous about it. I don't know. They haven't met yet. I know that the medical community has raised concerns about whether or not, again, they have the commensurate backgrounds to be able to understand the data and the evidence and to evaluate it appropriately. I haven't prejudged. I don't know what will happen, but I certainly will be watching.
Dr. Howery?
I have significant concerns as the public hasn't been able to weigh in. The general vote should have been posted 2 weeks ago so the public knew what was being discussed other than high-level things. There haven't been work groups other than for COVID, and there haven't been, as of yesterday, the data hadn't been posted yet. So it's unclear to me what decisions are being made